All right, so welcome everybody to well, this is actually the May All Shield call, if we're honest, because we moved the May call to June. It's the usual agenda. Oops, I did not update this piece of it. We don't need to vote. We got that done. Um, and we have some open topics as follow-up as well. So the big announcement from HL7 is that the catalog Fire IG has finally been published. So yay. We hope Live It will come next month. And LRI has passed ballot and we start working on ballot reconciliation on the Friday lab calls, I think, starting this week. Um, the other updates are kind of the same. We're trying to really get ready for the next Fire R6 ballot. One of the discussions we had at the working group meeting, and we can do more updates on the working group meeting, is that we did talk a little bit more about the pattern for grouping observations in lab reports. And after going back and forth and back and forth, we really couldn't decide on one pattern. We decided to support both patterns and then provide guiding text. If you use this pattern, these are the gotchas or things to consider. And if you use this other pattern, likewise. The one pattern is where a bundle will always only have one diagnostic report resource. That's the overarching representing the entire report of record with references to, um, and Christine, I'm going to make you co-host so you can help me let people in because I just noticed somebody was waiting there in the um, waiting room. So with references to multiple observations, and then if you need to group observations, you're going to use an observation resource and using the has member functionality to do that. Whereas in pattern two, a diagnostic report represents one panel. So you're grouping using the diagnostic report resource, and there is not a single main overarching resource that represents the report of record. It's the bundle altogether would be that. So, um, and we can talk more about that. Um, uh, let's see, what other announcements of interest? I don't know if everybody has heard, but
Becky,
yeah.
if you want to go back, I was just putting some examples in the chat just
Okay.
so folks are clear on the grouping aspects. So like the diagnostic report resource in the second one is using the fire diagnostic report for every type of section, like in a path report or, each type of grouping that's needed.
Well, actually, sections. So unless they are, I mean,
Because that's what I was asking last week on the all shit or the steering committee call,
yeah, I
because you're
mean
using the
this.
diagnostic report resource for the grouping.
Yes, that's pattern. That is pattern
So,
too.
so
But
that would
I
be
don't.
like the CAP cancer protocols, that would be path reports, genomics reports, other types of reports that would, if folks would try to go that approach. The other one at the top, I think was which what you're starting to talk about was observation has members. So there's a fire observation that would be used for
Mhm.
like report sections, and then all the items that are in that section of a report would be grouped together. And then you'd have another observation and fire that would have another report section. And then all those things would be grouped together.
And if you need to have an order to that, that would be done using the composition resource, but that would happen in either of those two patterns.
So, so some of those, may or may not be feasible in the US. It may be just the top one that folks, but globally, folks are using both.
Yeah,
So,
and that's why we couldn't
because
get
there's no
the
US
global.
implementation guides for Fire for Lab yet.
That's right.
Like that.
Yeah.
So,
Yeah. Yeah. Thanks for the clarification.
yeah, it's just helpful to use the examples too, that so folks are kind of
Hmm.
thinking about what they see on a daily basis.
Yeah. Maybe I'll put here that composition. Um,
This will be interesting eventually when LISs can support Fire, if
mhm.
how the data is structured in the data dictionaries with encoding can be used to
Mhm.
populate these strictly on the LIS, or if there's going to be a lot of gymnastics required um, to be able to use these structures and approaches.
Yep. So other updates, I assume probably all of you have heard that Clem McDonald passed away. There, I found two in memoriam pages. If other folks have others that they want me to add, please put them in the chat. I'll put them here. I know I will miss his guidance and his humor and his presence, and but we will keep it on. So. Um, And then Reagan Street has released new links for the Andes virus outbreak and the Bundi Bugyo Ebola outbreak. I have the linked to the pre-release codes here, and we're working on publishing the Livid files. We're focusing on the hantavirus first, just because it's a smaller set of tests that in at least in the US, and then for Ebola. And I'm also working on a process for future emergency response situations that are not necessarily just in the US to make sure uh, we consider how to report these things in a standard manner when they pop up. So to make sure that.
One other thing, I don't know, Jim, can you check to make sure that the SNMID codes that supposedly were requested are in the queue for SNMID? And I'll provide a link here.
So
Um,
have you submit has have codes been requested?
I think John did. We talked about it on the lab link call.
Do you want to go to the,
Yeah.
let me look real quick. I can just check CRS real quick.
So that for SNOMED, there's organism codes for both. It would be the diagnosis. I think it was the Bundy Bungu.
Go to topics. Organism.
Because it was available for one of them, but not the others. And as long as it's in the queue, and it'll be and I put in the chat, I did a write-up of this.
Mhm.
Basically, I want to give kudos to the Loink team. They got the codes out like within 48 hours, and I know people were HL7. Um, there's a little bit more information in kind of and because of the global need. Um, just want to get the SNMID codes. And then I know there have been questions about CPT ICD-10 codes. There are ICD-11 codes, but since ICD-11 is not used in the US yet, those wouldn't be necessarily, they could be used outside the US for countries that are using them. And then I see Neil's on. I know Canada, I was going to say, they had a lot of great documentation from their national microbiology laboratory in Winnipeg about the testing they're doing for both of these. So I don't know if any of you have any updates or anything like that too.
So I don't see any organism requests from John
No, they
on
wouldn't be
those.
organism codes. The organism codes exist. It would be
Yeah.
for the diagnosis that's related to the organism. One has it and one does not.
Yeah.
I forgot which one.
When would he have requested those?
We
Mm,
talked about it like about a week ago in the link call. I just asked if someone could request them, so I don't know if the request
Let's
ever
see.
went through. If it didn't, we still might need them.
I do not see them.
okay.
So
Okay, we'll submit them.
Thank you for confirming that.
they still may be in his, they may not have been
Yeah,
forwarded to us yet.
Yeah,
I know he
I'll
looked it
check
up
with
on the
John.
link call. Yeah, I've emailed him a couple times and he hasn't responded, so I'm not quite sure if he's out of office or.
Yeah, I'll check with him and I'll look up which one of the disorder codes is missing. Obviously, too. um,
Order codes? What do you
uh,
mean?
disorder
Oh,
codes.
okay, sorry. Okay, sorry. I thought you said order codes.
No, disorder.
Thank you.
Sorry. Maybe I'm mumbling.
No, it just probably got cut off. But I
Yeah.
knew, Anil, you were going to say something.
Yeah, I was saying when we were at the Loink, sorry, at the HL7 Netherlands, I think we got the request into Loink pretty quickly, and Isa was there too. I think so. That was what helped getting those codes in fairly quickly and in a pre-release. And our National Microbiology Lab in Manitoba is the confirmation place where it does all the testing. But I realized, BC, which had the initial one of the patients there, they were still doing documents, and so it was sort of sad. It didn't get down to the discrete level, but that's okay.
No, appreciate the updates to make sure that, the coding needs, because it is global
Yeah,
or available for folk, the
yeah,
different types of needs.
yeah. There's a
And one
HT,
thing, oh, go
oh,
ahead.
yeah, there's a HT health terminologies call coming up in a couple of weeks, and I think that's where Linda Monaco will bring it up and ask support of it.
I did see that Roche, actually, over the weekend or late last week I was out.
Hmm.
Roche has a test that they stood up that is considered a research, so not for clinical use, but I understand that some public health labs might be investigating or looking into it. So I don't I need to learn more about that one too. I can maybe put the
Oh,
link in the chat when find it.
Okay, and that is that for the Hanta or the Ebola?
I'm
and
trying to
I
remember
think.
which one. Hold on a second, let me look it up.
That's all right. When you put the link in, I'll click on it and we'll figure it out. But we do have a Livet file or a Livet group meeting this week, so I'm hoping to get that Hunza Livet file reviewed, and if there's any adjustments that need to get made to the loin codes or new ones added, we will take care of that this week. For the hantavirus, I have not been able to tackle also the Ebola, so that's next week. All right. Any other announcements, like maybe government announcements or anything else people want to talk about?
Well, maybe if people are interested, the application for my position is open until I think either the 18th or the 28th.
Uh,
People are interested in pursuing that.
I can link. I think it's June 19th, maybe.
I
Something
think
like
so.
that. I'll add it. I'll add the link to it. Oh, Bidingable, okay. And sorry, I have to click on all these links because that's the only way I can get them out of the chat.
I'm gonna look for the other one, but that was the first one that came up, so.
Okay. All right. Any other announcements? If not, we can look at upcoming meetings. So I know this is 2027, but submissions are open till June 30th. So I'm not sure if we have any topics that are different from what we submitted for the last HIMSS conference. We wanted to try for that. I'm not sure. Any other upcoming meetings that folks know about with open submissions? Not. Then update from recent meetings. So at the working group meeting, we already talked about the observation grouping, solutions, patterns, and then the U.S. patient care summary was tested at Connectathon and worked on ballot reconciliation for that. And then Anil said the blank requests for hantavirus and hold on. Any other things from the HL7 working group meeting? Any other updates from folks that were there? It was a smaller group than usual. A couple of work group meetings, work groups didn't meet. But okay. All right, so I will put that in as well. And I'll fix the slides before I post them, so it doesn't run over. Anybody else from the working group meeting? If not, we steering committee met last week. Still working on that Vision 2030 paper. It's a slow process trying to pull libid files together for very common tests where there's lots of uh, tests available. The hardest part is trying to figure out which tests are actually available from the FDA and still active. And the tooling for looking those things up is really, really cumbersome. So I'm not sure if there's any way to get that done any easier. And we still don't have an FDA representative. We also don't have an official NLM representative. And one of our healthcare provider positions, that person, Scott Campbell, moved to be a CAP employee. So we actually have an open slot in the healthcare provider category. We also have an open slot in the industry entity category since Roche didn't come back. And we have an open slot for a patient advocate. So if anybody is interested in filling those on the steering committee or knows of anybody who would be good, please let them know and have them reach out to Andrea and myself. And we did update the charter. I've linked the updated charter here. We made some changes for term expirations since we were having trouble even filling slots. We don't want to term people out and then have nobody on the steering committee. And we also made it a little bit easier to have the participation of people at the steering committee. Our next call is June 17th. IBD Data Hub working groups on hold. We don't have any chair, and we also don't have any FDA liaison. So hopefully at some point we'll hear more. I've reached out to them a couple of times. The leader work group meets every other week on Tuesdays in the morning. Last meeting was when, let me see here, in May. So we've been missing a couple because of working group meeting and other things. But we are basically working on pulling together those livid files for a few panels and commonly performed tests like hemoglobin A1C, the CBC, the CMP, a lipid panel. And then we threw in SARS-CoV-2 because we have an existing lipid file for that. So, and we will try to see if we can get manufacturers to get lipid files from manufacturers for these once we know who they are. And if they can't give us lipid files, then we're going to ask them for their LOIN codes if they have them, and build that leader content. But it's a lot of work. And we're also trying to decide on a consistent representation of the UDI components or the full UDI in HL7 messaging from the instrument to the LIS and then from the LIS to EHRs and public health surveillance systems and so on. So we're trying to get that figured out, and our next call is June 16th. Communications and branding working group. They were looking at the upcoming conference submissions. We've created a page for the prior Shield presentations, which I'll lock probably so that people can't change content. I haven't managed to upload all of them yet. But it is a small working group, so if you want to be added to the working group, please contact Eric. Kevin, do you have any other updates?
No, I think you actually might have covered a few of them already with the upcoming conferences that we identified, or the ones that had the open submission. So I think that was the main thing. Maybe another thing is that we're putting a little bit more effort into getting a lot of the events and things up on the LinkedIn page, and so we might start inviting folks that are regulars from the call to start joining the LinkedIn page to give it a larger presence, so that when we post things to it, it should go to a greater number of people.
I mean, if you just go, if you go to this LinkedIn page and say follow, isn't that how you also can subscribe to it? So you don't have to invite people to it, or
Sure.
let's
If
remember.
people search for the Shield Working Group, they can find it and they'd follow it, and that would be great. We might also be a little more proactive about hunting them down, just to increase the number quickly.
Yeah, so the link it to the page is right here in the minutes. So once I've posted them here in a little bit, you can also get to it without searching for it directly from this link. And then please add yourself as a follower if you want to support it getting more views.
It's not,
Do
I'm
you-
sorry, Ricky, it's not listed as
Absolutely.
a nonprofit in London, Shield Collaborative.
What?
I'm looking in LinkedIn for it, and I might need to wait for an invite.
Yeah, I'm only seeing the one in London as well. When I
Oh,
look at Field Collaborative, that's the only thing
okay.
that comes up for me.
Thanks,
Okay.
Carmen. Thought I was losing my mind.
I thought I was losing my mind as well, so
Okay,
thank
try.
you.
I put the link I have in the chat. Try that,
Okay.
and then let me know. And Kevin, do you know when the next call is?
The next, let's see, we did some rescheduling based on upcoming conference travel that we have going on. So, 1 second. The next call is on Wednesday, the 24th at 11 Central.
Okay. Oh, Central, so 12 Eastern.
Yeah.
Great.
Thanks, Ricky. The link worked too.
Okay. Excellent. Awesome. So if you're not already following it, and do you feel like supporting that, follow
So
it.
Pam,
And
Pam,
we
you're a
can-
member already. Is there anyone else that would
Oh
like
yeah,
a,
as of 3 seconds ago.
is there
Yeah, I
anyone
sent
else
my
who'd
request
like
in.
a invite?
I sent a request in.
Okay, thanks. I'll add you too. I think I can, you? Thanks.
Okay.
Great. All right. And then standards and vocabulary working group, Julia and Scott are co-chairs. It hasn't met in a long time, and the first call is scheduled for Tuesday, June 23rd, from 10 to 11 a.m. Eastern. So if any of you don't have that invite on your calendar and want to be included, please email Julia and she can send you that invite. And she's not scheduled any recurring meetings because I think on that particular call, we're going to try to find the best time for everybody who's attending that call. So
Can you have her send out to the folks that she left off that were on the group before?
I did tell her that.
The
I did tell
invite,
her
or
that.
can someone send forward the invite to the folks that were left off so they get the call details before the call?
Yes,
Okay.
I did send
Well,
her the list of people to send it to, but I can also forward my invite to
okay.
said list. Okay, will do.
In no rush, but just before the 23rd so folks can get it on their
Ha,
calendar.
yes, yes, I will make myself a note. Okay. And then we've got the question from the lab COP that I think we introduced and talked about on the last All Shield call. Nancy Cornish was on, and Manjula, you can help keep me honest here. So the CDC is working on coming up with quality measures to support bacteremia surveillance and blood culture contamination review. And so one of the things that is part of those guidance documents is or what you need to do to understand and interpret the results from your blood culture is to know the volume of the blood that was collected. And so the question that came up was because the blood culture is always collected as a set. Is that volume collected for each bottle, or is it the total volume in both bottles? And then how is that reported? And is that measurement LOINC encoded? And if so, which LOINC do you use? So I don't know if folks that are on have any thoughts on that matter. I know Nancy scheduled a meeting with BioMérieux because one of their instruments does include that in the report, but we don't exactly know more details than that. So,
Yeah, so they're kind of piggybacking off of some of the accreditation requirements, as Ricky mentioned. Um, a lot, and those of you who've already responded, thank you for letting us know what occurs in your laboratories. Some laboratories are reporting the accreditation separate from their LIS and EHR, but utilizing data from that. So it's like a separate reporting channel. And then this would be different in the sense of having some of the same data, but running it through from the LIS to the EHR. So, and then through a fire implementation guide for reporting for the quality measure requirements for facilities at a future point. They also want to have all laboratory tests, was another thing that they indicated with Loink and SNOMED, etc. So I don't know when that might go into play, but as Ricky mentioned, kind of understanding if and how the total volumes of blood culture bottles for each bottle collected is recorded. Is it in the LIS? Do you have a bill? Do you not record it? Understanding that would help the team understand, how this could be reported currently or what future needs would be needed. One of those is we've kind of talked about, so we, create a link panel for blood culture volumes and having the capability for each individual bottle and then a total calculation, kind of like some other link panels potentially.
And I think the focus is right now very much on the blood culture bottles. I think the notion to go into other tests is probably pretty far ahead in the future. So we can focus on the blood culture bottles.
we'll do we'll do that.
Mhm.
Any other topics, buddy? I guess one thing that we did talk on the steering committee that I just remembered that we haven't, I don't know if we've talked about it on this call, is that the HL7 working group meeting in September is in the DC area. It's in Bethesda. And so the steering committee was talking about maybe trying to get a face-to-face meeting for those people that attend that meeting or are in the area or could come for a time. So we're trying to figure out our options for hosting that. And while we were discussing that, there were two other offers for potential hosts for a face-to-face at a different time in the future. But just wanting to make people aware that we're considering that. So if anybody has any thoughts on what dates and time would work best for that, it would be face to face, but we would also provide a call in for folks that might want to attend that virtual. Of course, that's always a little harder to be the virtual attendee in a in-person meeting, but we try to work that out. And we would either do it as a adjunct quarter, like a Q5, so 5 to 7 or something, at the working group meetings location, or we might find a related venue in the area around the working group meeting times. And maybe I'll put that under upcoming meetings so folks can think more about it.
That's a good idea. We appreciate those who have stepped up and volunteered because, as you know, Shield has no budget to. So we're trying to do everything kind of. Can we get everyone together?
Yeah, I'll put it on here. All right. I'll fill out more details before I post the slides. If I'm not hearing any other topics, I'll go look at the Shield call. So our June call actually falls on the 23rd, which is an office closure day for APHL. So the question is, should we move it to June 30th? Since we happen to have the luxury of having 5 Tuesdays in June. What do folks think? That way we don't really miss an update call.
It works for me.
Okay. I'll just do that. I'll send an updated, I'll update that calendar invite. And then we don't have any special project updates, special topic call topics at the moment. So if anybody has anything they want to present on or hear about, topic ideas for the July 14th and the August 11th call, let us know. We're wide open for the rest of all the special topic calls. So if nobody has anything else, I will give you guys a couple minutes back. Thanks, everybody. Talk
you.
to you on June 30th, if not before, on any of the other working groups.
Thank you.
Thank you.
Thank you.